How to cope with hair loss and body image after breast cancer chemo. Coping with hair loss and body image changes after chemotherapy for breast cancer can be a challenging journey. Many women experience hair loss as a common side effect of treatment, which can significantly affect self-esteem and body image. Understanding this process is the first step toward coping effectively. Chemotherapy targets rapidly dividing cancer cells, but it also affects other fast-growing cells, including those in hair follicles. This can lead to thinning hair or complete hair loss on the scalp and body. For most women, this hair loss is temporary, with regrowth typically starting weeks to months after treatment ends. However, some may experience long-term or even permanent hair thinning, especially with certain chemotherapy drugs. This ongoing hair loss can lead to distress and impact quality of life. Preparing for hair loss can help ease the emotional burden. Before starting chemotherapy, it's helpful to discuss the likelihood and extent of hair loss with your healthcare team. Planning ahead can include choosing comfortable and aesthetically pleasing head coverings like scarves, hats, or wigs. This preparation can provide a sense of control and boost self-esteem during treatment. During and after treatment, there are ways to manage hair loss. Some patients find that scalp cooling caps can reduce hair loss by lowering scalp temperature during chemotherapy, though effectiveness can vary. While topical minoxidil may not prevent hair loss during treatment, it might help speed up regrowth afterward. Recent studies suggest that low-dose oral minoxidil could be safe and effective for promoting hair regrowth, but this should only be used under medical supervision. It's also important to accept that hair may grow back with different texture or color. Addressing body image and emotional well-being is crucial. Hair loss can deeply affect self-confidence and mental health. Seeking psychological support through counseling or support groups for breast cancer survivors can be beneficial. Engaging in self-care practices, such as skin care or experimenting with new styles, can enhance your sense of identity. Open communication with family, friends, and healthcare providers about your feelings can help reduce feelings of isolation and provide emotional support. Remember, it's normal to have concerns about body image, and adjusting to these changes takes time. For those facing persistent hair thinning or loss long after chemotherapy, discussing options with dermatologists or oncology specialists can provide additional support. Emerging therapies and counseling can help manage the psychological impact of these changes. In summary, coping with hair loss and body image changes after breast cancer chemotherapy involves a mix of medical guidance, practical preparations, emotional support, and self-acceptance. Engaging with healthcare providers about treatment side effects and supportive care options is essential to navigate this challenging aspect of survivorship.